thanks to the sunshine. But coming up in the full forecast, we're talking heat advisories and some serious warmth early next week.
Sounds good, Jeremy. We'll check back in with you later in the show. Just one day after announcing the closure of several clinic programs in Spokane and Stevens counties, Providence is shedding light on what the next few months will look like before the programs are shuttered in October. KREM 2's Christian Garza shares what patients can expect.
After speaking with Providence today, patients who use these programs in clinics like St. Luke's Rehabilitation Medical Center right here behind me will get a letter in the mail here soon about what these next few months will look like.
Following Providence's announcement of ending several programs throughout the inland Northwest,
yeah, sad.
Patients like Carla Crowther are left with more questions than answers.
First reaction, we panicked out yesterday.
Questions surrounding what this transition period will look like before these programs end in October. Crowther, who lives in Loon Lake, says at the end of the day, this news makes her worry more for her wife than for herself because it means having to potentially travel farther for care.
Well, it scared me when it came to Sherry because she doesn't drive anymore, so I have to drive her around, and we know that we don't travel in the winter when it gets bad.
According to Providence, the letter being sent out to patients will revisit the reasoning behind the decision to cut these programs, as well as providing resources for other potential clinics around the area for patients to visit.
Healthcare and hospitals specifically are facing really strong headwinds right now.
Jacqueline Barton-True, the Vice President of Advocacy and Rural Health for the Washington State Hospital Association, says Providence isn't the only hospital making these sort of cuts across the state.
And when we see hospitals make the unfortunate decisions that they have to make to close services or to consolidate or to move them to other locations, it's usually done with the idea that you are preserving that fundamental access to care, and doing these hard things today is preserving that access for the community in the future.
Barton-True says hospitals are struggling, especially after losing $4 billion during the pandemic, and now are expected to lose close to $6 billion as a result of the Trump administration's One Big Beautiful Bill.
So any reserves that hospitals had to absorb some of these challenges that are coming financially, they're gone. They've been used.
Crowther says while she knows the future is still uncertain, she just hopes that communication will stay open as she figures out what to do next for her family.
I guess you adapt easier when you're younger. At 73, you don't adapt as easily. You don't want things to change.
Providence tells KREM 2 that they will continue to work with patients to make sure that they get proper care throughout and after this transition. In Spokane, Christian Garza, KREM 2 News.